our social media platforms. Talk to us and we shall be getting back to you a little bit later. But now let's go straight to stories making headlines now. A census report on Kenya's health facilities tells of a sorry state of affairs, with only 7% of the facilities said to be in a position to offer quality healthcare. The report, unveiled by Health Cabinet Secretary Susan Nakhumicha, further says that only 6% of the health facilities offer pharmaceutical services. Speaking during the occasion, Nakhumicha said the government will study the report and take appropriate action to remedy the situation to ensure that healthcare is offered to all. Husna Mohammed with that story.
Various stakeholders in the health sector attended an event to officially launch the Kenya Health Facility Census Report in Nairobi. The census exercise officially started in August this year and targeted 12,384 health facilities. The survey found out that 2,633 facilities were not captured in the Kenya Master Facility List, while 203 health centers in the country refused to be inspected. Health Cabinet Secretary Susan Nakhumicha, who launched the report, has ordered investigations on the 203 health facilities
to ensure that those facilities that locked us out are inspected with immediate effect. And for those that closed strategically so that not to be inspected are equally inspected.
In the report released, maternity is the most affected. Out of all the centers that provide maternity services, only 16% had the necessary services and equipment. Failure to have comprehensive maternal care is the main cause of maternal deaths in the country that stand at 365 deaths per 10,000 live births.
Of all the facilities in this country, only 7% are ready to provide services. And that only 6% of the tracer pharmaceutical services are available in facilities.
According to the report, out of 12,375 health facilities assessed, only 22% offer critical services with limited healthcare personnel. Only 12 counties have the required core health worker numbers per population. Dentists and radiologists were scarce across the hospital levels. The top 3 counties with the most hospitals are Kitui, Homa Bay and Baringo, and the 3 with the least hospitals are Mombasa, Isiolo and Lamu.
The data that has been shared with us will support health sector reviews and ensure that we have evidence-based decision-making for strengthening our country health services.
Advanced life support ambulances were only accessible in 31% of the health facilities, while public hospitals were cited as providing poor emergency health services. The counties in the northern parts of the country were found to be running without ICU services.
If we don't address these gaps, then it will be a mirage to achieve UHC.
The report has shown that the state of healthcare is still below par for the country 60 years after becoming independent. Husna Mohammed, KT News, Nairobi County.
Thank you, Husna, for that report. And just to remind you, a sign language interpreter is Philip Omondi. Now tonight,